NHA CCMA test review session. Question 1. When coding an office visit encounter, which code set is used to report a provider's diagnostic evaluation and clinical decisions? Option A, CPT codes. Option B, ICD-10-CM codes. Option C, HCPCS Level 2 codes. Option D, modifier codes. The correct answer is option B, ICD-10-CM codes. ICD-10-CM, International Classification of Diseases, 10th revision, clinical modification, codes are used to report diagnoses, conditions, signs, and symptoms. CPT codes describe the services and procedures performed. Both code sets must be included on a complete claim. Question 2. A medical assistant is preparing to submit an insurance claim using the standard paper billing form. Which form is used for outpatient clinic services? Option A, CMS 1500. Option B, UB04. Option C, DA 2501. Option D, CMS 1450. The correct answer is option A, CMS 1500. The CMS 1500 is the universal claim form used by non-institutional providers, including physician offices and outpatient clinics, to submit claims to Medicare, Medicaid, and most commercial insurers. The UB04, CMS 1450, is used by hospitals and institutional providers. Question 3. Which tube should be collected first if a provider orders a blood culture, a prothrombin time, patient, and an electrolyte panel? Option A, light blue top tube. Option B, yellow top blood culture tube. Option C, green top tube. Option D, red top tube. The correct answer is option B, yellow top blood culture tube. Per CLSI order of draw, blood culture bottles, yellow top, are collected first to avoid additive contamination and to minimize skin organism contamination before other tubes. Blood cultures are followed by light blue coagulation tubes, then other additives. Question 4. A patient is non-compliant with their hypertensive medication because they do not understand why they must take a pill when they feel fine. What action should the medical assistant take? Option A, inform the patient that they will be dismissed from the practice. Option B, provide educational materials explaining asymptomatic hypertension. Option C, tell the patient to double the dose when they feel stressed. Option D, document the non-compliance and ignore the issue. The correct answer is option B, provide educational materials explaining asymptomatic hypertension. Hypertension is often asymptomatic until it causes end organ damage, so patient education explaining this concept is essential for compliance. The medical assistant should provide appropriate materials and notify the provider. Dismissing or ignoring non-compliance is clinically and ethically inappropriate. Question 5. A clinical medical assistant is discussing a patient's new diagnosis of macrocytic anemia. What does the term macrocytic mean? Option A, unusually small red blood cells. Option B, unusually large red blood cells. Option C, decreased number of white blood cells. Option D, irregularly shaped platelets. The correct answer is option B, unusually large red blood cells. The prefix macro means large and cytic refers to cells, so macrocytic describes abnormally large red blood cells. This is seen in vitamin B1, 2 and folate deficiencies. Microcytic, small cells, is the opposite finding, seen in iron deficiency anemia. Question 6. When a patient uses an adaptive mechanism of projecting their own unacceptable feelings onto another person, which defense mechanism is being demonstrated? Option A, sublimation. Option B, projection. Option C, displacement. Option D, rationalization. The correct answer is option B, projection. Projection involves attributing one's own unacceptable thoughts or feelings to someone else. Displacement redirects emotion toward a substitute target, while sublimation channels unacceptable impulses into socially acceptable behaviors. Question 7. When coordinating care for an older adult patient who is transitioning from an acute hospital stay to a skilled nursing facility, what is the primary goal? Option A. To increase out-of-pocket costs for the patient. Option B. To ensure continuity of care and safe execution of orders. Option C. To limit the number of medications the patient takes. Option D. To prevent the family from visiting the patient's room. The correct answer is option B. To ensure continuity of care and safe execution of orders. Care transitions require meticulous communication of active diagnoses, medication lists, and treatment orders to the receiving facility to prevent gaps in care, medication errors, and readmissions. Continuity of care is the central goal of all transitional care planning. Question 8. Which of the following structures separates the thoracic cavity from the abdominal cavity? Option A. Pleural membrane. Option B. Diaphragm. Option C. Peritoneum. Option D. Intercostal muscles. The correct answer is option B. Diaphragm. The diaphragm is the dome-shaped skeletal muscle that physically divides the thoracic cavity above from the abdominal cavity below. It also serves as the primary muscle of respiration. The pleural membrane lines the lungs, and the peritoneum lines the abdominal organs. Question 9. When collecting a sputum specimen for culture, when is the best time to instruct the patient to collect the sample? Option A. Immediately before going to bed. Option B. Right after eating a heavy lunch. Option C. First thing in the morning before eating or drinking. Option D. Mid-afternoon following an exercise routine. The correct answer is option C. First thing in the morning before eating or drinking. Sputum is best collected upon awakening in the morning before eating, drinking, or oral hygiene, as respiratory secretions pool in the lower airways overnight. This yields the highest concentration of organisms and the most clinically representative specimen. Question 10. Which of the following cleaning methods kills all pathogenic microorganisms, including bacterial spores? Option A. Sanitization. Option B. Disinfection. Option C. Sterilization. Option D. Ultrasonic cleaning. The correct answer is option C. Sterilization. Sterilization is the only method that destroys all forms of microbial life, including highly resistant bacterial endospores. Disinfection eliminates most pathogens but not spores. Sanitization reduces microbial counts to safe levels but does not kill all pathogens. Question 11. An orthostatic blood pressure measurement requires the medical assistant to check the patient's blood pressure and pulse in which sequence of positions? Option A. Sitting, supine, standing. Option B. Supine, sitting, standing. Option C. Standing, sitting, supine. Option D. Prone, Fowler's, lithotomy. The correct answer is option B. Supine, sitting, standing. Orthostatic vital signs are measured supine first, baseline, then sitting, then standing to detect positional drops in blood pressure. A systolic decrease of 20 mm Hg or more upon standing indicates orthostatic hypotension. Question 12. What is the fundamental functional unit of the nervous system responsible for transmitting electrical impulses? Option A. Nephron. Option B. Alveolus. Option C. Neuron. Option D. Osteon. The correct answer is option C. Neuron. The neuron is the structural and functional unit of the nervous system, transmitting electrochemical signals throughout the body. The nephron is the functional unit of the kidney, and the alveolus is the gas exchange unit of the lung. Question 13. When discarding a contaminated gauze square saturated with blood, where should the medical assistant place it? Option A. In a regular covered waste receptacle. Option B. In a biohazard puncture-proof sharps container. Option C. In a red biohazard waste bag. Option D. In a recycling container for medical items. The correct answer is option C. In a red biohazard waste bag. Blood-saturated items that are not sharps are classified as regulated medical waste, biohazardous waste, and must be disposed of in a red biohazard bag. Sharps containers are reserved for needles, lancets, and other puncture risk items. Question 14. A medical assistant is participating in a patient-centered medical home, PCMH, model of care. What is a core concept of this healthcare delivery design? Option A. Fragmented specialty care focused on acute injuries. Option B. Comprehensive, team-based care centered around the patient. Option C. Minimizing communication between providers to reduce cost. Option D. Prioritizing diagnostic testing over preventative wellness. The correct answer is option B. Comprehensive, team-based care centered around the patient. The PCMH model emphasizes comprehensive, coordinated, team-based primary care that is patient-centered and focused on continuity. It integrates preventive care, chronic disease management, and care coordination across all settings to improve outcomes and reduce fragmentation. Question 15. A medical assistant is applying a cold compress to a patient's sprained ankle. How long should the compress remain on the skin to prevent tissue damage? Option A. 5 to 10 minutes. Option B. 15 to 20 minutes. Option C. 40 to 45 minutes. Option D. 60 minutes. The correct answer is option B. 15 to 20 minutes. Cold therapy should be applied for 15 to 20 minutes per session to achieve therapeutic vasoconstriction and reduce inflammation without causing tissue damage such as frostbite. Application beyond 20 to 30 minutes can lead to paradoxical vasodilation and skin injury. Question 16. According to OSHA and standard precautions, which item of personal protective equipment, PPE, must always be worn when performing venipuncture? Option A. Goggles. Option B. N95 respirator. Option C. Gloves. Option D. Fluid-resistant gown. The correct answer is option C. Gloves. Gloves are mandatory for all venipuncture procedures under standard precautions to protect against blood-borne pathogen exposure. Goggles and gowns are added when splashing is anticipated. An N95 is required only for airborne precautions, not routine phlebotomy. Question 17. When archiving or purging paper medical records, what determines the length of time records must be legally retained? Option A. The clinic owner's personal preference. Option B. State and federal laws regarding retention periods. Option C. The storage capacity of the medical facility. Option D. The alphabetization style used in the office. The correct answer is option B. State and federal laws regarding retention periods. Medical record retention is governed by state and federal statutes, which vary by record type and patient age. Adult records are typically retained 7 to 10 years, minor records must often be kept until the patient reaches adulthood plus an additional period. Deviating from legal requirements can expose the practice to liability. Question 18. A medical assistant is calculating the body mass index, BMI, for a patient. Which of the following measurements are required to complete this calculation? Option A. Height and chest circumference. Option B. Weight and waist circumference. Option C. Height and weight. Option D. Age and weight. The correct answer is option C. Height and weight. BMI is calculated using height and weight only, using the formula, weight, kg, divided by height, m, squared. Waist circumference is a separate measure of central adiposity and is not part of the BMI formula. Question 19. A medical assistant is checking the liquid controls for a CLIA waived gluconate device. How often should these quality control checks be performed according to manufacturer standards? Option A. Once every month. Option B. On days when patient tests are performed. Option C. Only when a new medical assistant is hired. Option D. Every time a new patient is brought in. The correct answer is option B. On days when patient tests are performed. Quality control for CLIA waived point-of-care devices must be run on each day that patient testing is performed, per manufacturer instructions and CLIA guidelines. This ensures the device is functioning accurately before any patient results are reported. Question 20. A patient presents with symptoms of an upper respiratory tract infection. Which of the following structures is part of the upper respiratory tract? Option A. Trachea. Option B. Bronchi. Option C. Pharynx. Option D. Alveoli. The correct answer is option C. Pharynx. The upper respiratory tract includes the nose, nasal cavity, pharynx, and larynx. The trachea, bronchi, and alveoli are all components of the lower respiratory tract. URIs commonly include the common cold, sinusitis, and pharyngitis.